Hello, everybody. Uh, we are today starting our Corona session, that is live Corona session that we are starting from today is about Beat the Corona session. Basically, the main purpose of this session is to help people about this Corona situations. Many of the parents they don't know how to tackle this and how to make themselves and their kids safe. Also they have a lot of questions about it, so we like to start this corona session just to show up um, all the guidelines, health guidelines, mainly of the UK, and we like to tell as much information from the NHS about helping the people with about this corona and about how they can help their children's in these corona situations. All these things we like to share with about all of this. Basically, anyway, I have seen most of the parents they are quite anxious about how to beat about this corona situation. Not only the parents but also some of the children they find it hard in these situations to do the things that normally they do. Sometimes they cannot do them that due to the anxiety. Maybe there is some manifestation you can see, mental or physical manifestation you can see among them, so that they find it's very hard to you know having this situation, how to tackle the situation. So as a whole it is not very easy situations, and we also don't know when this situation going to end. So together with all these things we are going to give some information, but too much information in one sessions will be also too much for everybody. So I thought, why not little by little we'll give the information about the corona, and give that information to the carer, how they can take care, how they can help themselves, also their kid, in these very grave situations. Some of them is really we are finding sometimes very hard, that how we can tackle this. So as a pediatrician I have some of this working in this UK. I know that how UK guidelines that is helping us to tackle these situations. So I am going to give those guidelines to you all, so that it can help many way, yourself and also your kids. So that is the reason of this session, and I'm going to tell you about it in this session. So all these things I'm together keeping it, the things, so that we can together fight back in this period of crisis, so that we can see a good result and we can survive as nicely as possible. So all these things together I am going to tell you today about some of the guidelines and some important facts about fighting back with corona things. So let's start with the session with a bit of basic knowledge that we need about the corona. And I think it is very important that we must know those basic things to check whether we are fighting or we are aware about all the things that we need to know about the corona. Okay, so let's start with these things first. First I'm going to tell you about any things that whether you or your child has any coronavirus symptom. That is the most important thing. I think we need to know that very importantly, that whether we are suffering from any corona or not. So that is the reason why, basing on that, I just like to tell you first the symptoms of the corona, so that you know about it and you can be aware whether you just have to do something for it. So that is very, very important thing, I believe. So let's start with the symptoms that you have to check for, not only for your kids but also for you. The some of the symptom that is very, and NHS has very clear cut guidelines, and to tell you what are the things you have to tell, that's COVID-19 main symptoms, and need a test as soon as possible. And of course, you have to, if you suspect that you may have or your child may have the COVID-19, then stay at home until you get the result. You have to do the test. So, what are the main symptoms? That is categorized very clearly. A high temperature, that means you feel hot to touch on your chest or your back, and that it is not important that you have to measure the temperature, but you are feeling hot. That is hot. If when you touch, you can feel in your chest and your back, you have to feel that. And if it is feeling very hot. Number two, a new continuous cough. This means coughing a lot for more than an hour, or three or more coughing episode in 24 hours. So, if you have already cough, you were suffering before in a long time, thumbs cough or something like that, that will be worsen than usual. So basically, this is a new continuous cough. This is a very important symptoms that you have to take it very seriously. Then after that, a loss or change of your sense of smell or taste. So this is another important thing that you will notice. You cannot smell or taste anything, or a or things smell or taste is a bit different to normal. So this one, I have some of the relative and my friend who had COVID, and it is a really particularly very good one. And they told me that yes, the sense of smell and taste is awful. You cannot taste anything or smell anything that period when you have corona. So most of these people with coronavirus have at least one of these symptoms. So you can understand these three symptoms you have to, very, very important, that you have to know when you need. So what to do if you have symptoms? If you have any of these MIM symptoms, then you have to get a test to check if you have coronavirus as soon as possible. And you and anyone you live with should stay at home and not have visitor until you get your test result. Only leave your home to have a test. So anyone in your support bubble should also stay home if they are in contact with you or you are mixing up that support bubble. You have been a close contact with them since your symptoms started or during 48 hours before they started. If anyone that is already contact, so they will also have to be staying at home. So this is the thing. It is really very, very clearly it is mentioned. And about support bubbles, it is very clearly mentioned in where someone who lives alone or just with their child can meet a people from one other household. So this is the support bubble that is told about these things. About it is very clearly mentioned UK government website. So this is other things you have to now. One thing I think it is very useful. NHS have 111 online coronavirus service. So I think I will show you that, because many of us wanted to how it would be used and things like that. So I'm going to show you that now, how we could actually use it. So let's show you that site so that you can also use if it is needed. It is very simple, and of course you will be, I'm going to show you that with this another screen, so that you can easily understand how it can be used. So I just going to share it now with now. Yeah. So basically I think I have shared it. Let me check with you. Yes. So can you see this is a 111 online things. So you can see this is this, it is quite clearly. You can see NHS and check your symptoms. You can start now. So I'm just going to show you a little bit of how you will use this site. It is quite simple and easy one to use. So start now. I'm clicking it. So you have to put your postcode. I'm showing a bit of example. Um, so you can see I'm putting the one of the postcode. And now, yes, check if it is, urgent, or you have to call 999 or not. That is quite clearly. So there is some specific signs they will ask for. Whether there is signs of heart attack, means you just written what means by heart attack. It's quite specifically mentioned. Why there is a signs of strokes, you can see it's face drooling one side, cannot hold arm up, difficulty in speaking, severe difficulty of breathing, not able to get words out, choking or gasping, heavy bleeding, that won't stop. This is another one. Severe injury, or you can see the seizure of feet. That is also another thing. And also sudden and rapid, swelling, that any part of the body, that is also very, very important. So actually, you have to contact them. Here there's contact lines of this emergency is the 999. So in this way you can really, so if you don't have none of this, you can go to the click on that. Then they will ask about, of course, if it is under 5, it is always better to call them. But if it is not, then you have to tell you there whether it is male or female. You have to put your age. We just can put it and then in go. And in that way, they will actually ask some other question like cough, high temperature. You have to give all these things. If you tell that is tiredness or whatever you have, if you have that, you just put it and go to next. So we will now ask questions about your symptom, and that may be relevant. They will tell you, and then you have to keep it like I understand. Do you have any continuous cough? I told no. Then it will come the next question. It's very simple, and you can see this is whether you don't have thermometer or to know a precise temperature. If you feel hot to touch on chest and back, if it is yes, then you will put yes. If it is no, you have to put no. And if anything, this just spell test. If you tell that yes, I have smell difficult in past. In this way, have you breathless? I told no, I'm not breathless. So anyway, you have to continuously give that answer in that the questions that is they will ask in this. You can see this is 111 online. Is quite easy. It's cause suddenly become confused that normal. If it is yes, you have to tell yes. If it is no, and if it is not sure, that is also you can write in that way. Next questions is it will come in all this way. Have you behaving in an odd way? If you odd way, you have to tell that. In that way, you have to proceed all this. You have been either of this in last 4 weeks. You have to tell if it is more 4 weeks or more. Palpitations as there. Have you any of this following? Ankle swelling, palpitation means pressing heart or things like that. It will come automatically. It's white part of the letter completely yellow. If it is completely yellow, you have to tell. So in this way, you can see this is a small explanatory. Many of these questions are there, and if you give this answer, coordination problem, weakness, so all they will ask. And you have to continuously quite these explanations you have to answer them quite easy to answer, and it is easier to get hold of them is better, I can see. And these answers you can give anything that is sweating or anything. There is not many of these questions are there. You just have to continuous to give that, and if you give that, you just give you answer of those questions, and you have to continue to give those answers, and in that way it will come in a point all these answers when it is complete or not. You just have to complete those answer will be counted, and then you just, so things look like that. could be due to coronavirus, which is infectious. We should avoid all contact. So it is in that way they will tell you what is the diagnosis after getting all the answer. They will. It is safe to look after yourself. So in that way, I given that instead that is weakness and things like that. So think it may be due to coronavirus or not thing, but if you need to go a medical appointment, do not use public transport. They are giving the advice based on one by symptoms I given, and they will tell you what to do. So you can see it is quite self-explanatory, and you can easily do it without any problem. So in this way, you can see it is quite use and handy to do that. Now I'm going to another one that is I think is very useful for you. This is a one chart, and with that chart, it is really nicely you can see how very importantly how can you just with one chart you can see it is showing everything about um, you know um, everything about advice for the parents about that. So I just showing you that one quickly. Yeah. So let me see if it is sharing or not. Yes. So it is that this is the advice for the parents during. You can see only one chart, but it has a lot of information. I'm showing you how it working. So you can see this advice for the parents during coronavirus. I will give this link in my after my session so that you can open these links very easily and you can use them without any discomfort. So you can see this one is showing the red zone, and there is some amber zone and some green zone. Green zone is the best. Amber zone is medium. Red zone is definitely it is showing that seriousness of the problem. So you have to see that red zone to check out if it is there is very serious problem. You can see all of them pale, mottle, and their breathing is stopping, irregular breathing, difficulty of breathing, keeping blue in the lip, having fits, and extremely distressed, crying inconsolably despite distraction, confused, lethargic, unresponsive, develop rash, does not disappear with pressure, and has testicular pain, especially in the teenage boy. So these are the red sign. You have to then phone 999. Amber is the middle problem. I can show you. You can see in the chart. So this amber problem, that means in between. It is not very serious, not very, absolutely nothing. That is not the thing. In between problem. So in this way, you can see whether there is, you see the head bobbing, is there is difficulty of breathing, some form of dehydration. Means you can see this is all the signs they have written nicely. So I will give you this link so that you can have this handy. You can quickly check whether your child has these types of problem: excessively sleepy, irritable, extremely shivering, muscle pain, babies 3 months of age, age with a temperature above 38, and 3 to 6 months 39 temperature or more temperature. For the infant and children, fever 38 or more for more than 5 days, getting worsened if you are worried, and persistent vomiting or persistent severe abdominal pain, blood in poo, and limb injury causing reduced movement, persistent pain, head injury causing persistent cry or drowsiness. Then you have to call your GP surgery or dial 111, because it is you need to discuss with the professional. And green side is absolutely fine. There is it's not that you can not worried if these are not there, then must be your child is not that bad. So in that way it is a very handy. I will give you that information guideline, and then you know what to do in what situation. Yes. So this is what this I called. It's really good one. Another one is for child. I'm going to give you that one also, because that one will be of very helpful. So that one I'm going to give you now. This one is also, I think it's really quite handy, and children will like to see them, and they will understand how to do the situations in this way. So it is for the children. They made it. COVID-19. What is COVID-19? It's a virus spreading across the world. The child who can read it, they can understand very well, and they can read. And if they cannot read, you can read for them and show them all this nice picture of this lovely kiddies and things like that. They will, I think, enjoy with that. And you can read about the COVID virus. What is it? what are the symptom it causes and how it spread. All is written. Can you see this is the droplets, and it means you need to close some close to somebody. So I'll give you this link also, so you can show it to your child, or the child who can read. You can tell them to read it so they know what to do, so where to call, what are the symptoms, and when it is needs to be tested. It's very nicely and handy. It is only one page, so they will be very happy. And there is nice picture you can see also surrounding, and the doctors and nurses will look after you. If you are unwell, need to wear funny clothes to protect you, to protect them, and to protect our people. And they need to make sure they are not spreading any infection. They're just normal people under the funny masks. That is the thing, we nowadays use those funny gowns. So these are the things it is very. And last thing I'm just today I'm going to tell you about is the what are the medicine. That is a questions for many. What are the medicine we can use for COVID? I think this COVID is a symptom just like any other viral illness. So advice from the NHS is that uh, mm, parents can use either paracetamol or ibuprofen that can be used to treat their child if they have symptoms of COVID-19, such as fever, headache, and also follow the NHS advice. If they have any questions or symptoms worsen, parents should always read the patient information while taking over-the-counter medicine. You have to read how much you can get. If you give less, that will not work. If you got more, that is give more, that is also not good. So you have to instruction, and also follow the instruction of previously. If there is any allergy, or the doctor tells not to give your child paracetamol, ibuprofen, not to give that medicine. Okay. And of course, manage the symptom of the fever, like giving dehydrated plenty of fluid and drink. And child's fever should not be undressed or over covered. So light covering is okay. So basically, you give this paracetamol, ibuprofen as per dose that is written on the label, and you should not give it regularly. But when a child is really distressed with the symptom, you can give this to comfort them. But even after giving, if you are still worried with this, it is always better to take the through the online. I already showed you how to take the online advice of NHS and 111, or you can call them. In either way, you have to, isn't it? So this is a basic initial session, just to make a little bit of hour about the COVIDs. And I think I will give you all this what I saw, all the website and all this leaflet, that only one page for childs and also for parents. I will give all this in my session below. After that, that below the session, I'll keep all this for you, so you can use it anytime. Okay, so later on, I will come with the testing and other, form of things we supposed to discuss with you in the next session in the next week. I want to discuss with you about different, things like parent and guardians. That is about all this, testing and things. Also, how you follow the rules when you are living with other elderly people and childrens, all are there, and we have to save our relatives and other people who are vulnerable. So how to do that, I will the next session I will try to discuss them. Hopefully this gradually it will increase our knowledge together, and we'll fight back with the corona, this situation, pandemic. Yeah, hopefully it will help you. And of course, keep that safe distance, use the mask, and wash your hand. Keep yourself safe, stay safe, and I think we will fight against corona. Yeah, and we'll fight back. Thank you for watching me, and we will again come back next week with other informations for it. So for today, bye.